Hi, welcome to Understanding Osteopathy. My name is Jenna Howe, and I'm with Catalyst Kinetics. And today we're going to be discussing what osteopathy is, the components of osteopathy, the techniques utilized, how it helps, and how it works with an interdisciplinary model with other therapists and in a clinic setting. What I'm going to do now is I'm going to share my screen. Okay, here we go. Oops, there. Now you should be able to see it. Just drop this down a little bit. Excellent. Okay, so as I said, my name is Jenna Howe. I'm an osteopathic manual therapist, and I'm working here at Catalyst Kinetics. I've also been in private practice for many years. My career started in kinesiology, exercise rehabilitation, personal training. I was a member of the Society for Exercise Physiology for a number of years, and I transitioned into manual therapy about 23 years ago, working with sports injuries, post-concussion, chronic pain. And then it evolved over time. And then I went back to school, got my psychology degree, and also continued on to get my diploma of osteopathic manual practice. So that takes us to where we are today. What is osteopathy or osteopathy? Doesn't matter how you say it. It's interchangeable. It's like potato, potato. And but osteopathy is a form of manual medicine that emphasizes the interrelationship between structure and function. It was created by Dr. Andrew Still in the United States. He was a medical physician who felt as though there would be more that you could do from an administrative perspective to help with medicine. So it originated in the United States. And in the United States today, it's still largely a medical practice. So it is a physician who then is also trained to do manual medicine in their practice. That is a differentiation that can be confusing for people in Canada, especially because there are some medical DOs in Canada, although not very many, that practice manual therapy as well. Manual therapists in general, osteopathic practitioners, use hands-on techniques to diagnose and treat various conditions affecting the musculoskeletal system. Having said that, it's a diagnostics from the osteopathic perspective, not a medical perspective. In Canada, the scope of practice for a manual osteopathic practitioner is not to diagnose specific conditions, but we would create an osteopathic diagnosis in terms of what we see and what we feel and what we're assessing for that individual person. So the core philosophy is that the body is a unit and the systems are interconnected and interdependent. It's kind of like if you have a car and if one wheel falls off the car, then the functionality of the car is going to be impacted. Same thing is if there's something else going on with the car, then it might impact how the wheels are turning. So I'm not much of a mechanic, but I think you get the idea of what I'm talking about and what it is that I'm trying to convey. It all works together. And you've probably worked with therapists who explain to you that the condition that you're presenting with or the symptomology you presented with maybe had a root cause somewhere else in the body. And you've often heard everything is connected. And then this is exactly what we're talking about. Also, another core philosophy in osteopathy is that the body has self-healing mechanisms. Osteopathy facilitates natural healing. The idea is that if the fluids of the body, so blood flow and lymphatic flow, are unobstructed, that also has better nerve conduction, then disease and dysfunction can then therefore not set into the body. From a contemporary perspective, we'd probably add a little bit more to that, but this is from the 1800s, early 1900s. So, of course, medicine, manual therapy has evolved and is a bit more contemporary and is a bit more rooted in science. But again, if everything is functioning well, we all know that in order for an injury or a wound or anything to heal properly, it needs adequate blood flow. And that's one of the primary tenets with osteopathy. Structure and function are reciprocally interrelated. So I mentioned that as the body is a unit, um, and that's interchangeable. So the body is a unit, all the systems are interconnected, right? So the muscles work in a kinetic chain. They work together with movement. We have antagonists and synergists. We have fascia that holds it all together. Our nerves are innervating our organs. Our organs are, working with, metabolism and all of the other processes of the body. It all works together. And then structure and function are interrelated. And as an osteopathic therapist, we often take a bit more of a global look. We're looking at all the systems of the body. And I'll go into it a little bit later in our talk about what you would expect if you were to book a session with me, because we're all a little bit different as well. In classic structural osteopathy, and I will discuss there's a couple of different systems of osteopathy, but in classic structural osteopathy, we work with five basic models of health. The biomechanical model seems pretty obvious. We have structure and function of the musculoskeletal system, bones, joints, muscles, fascia, posture, movement patterns. The term osteopathy can be a little bit misleading because people assume it's just working with the bones. But of course, over time, things evolved, and it might have started off that way with Dr. Still working predominantly with the ribs and the spine and the joints. But it's evolved. So in contemporary classic structural osteopathy, we're looking at all of the musculoskeletal system. Then we have the respiratory circulatory model. That's when we're looking at blood flow, lymphatic flow, breathing mechanics, ensuring proper delivery of oxygen and nutrients, and removal of waste products. So this might be where you might get more lymphatic drainage. We're always looking at making sure that we've got good blood flow to hypertonic muscles, into joints. We want to make sure that the breathing mechanisms are working well. How are you breathing? How are the ribs moving? How's the diaphragm moving? Where's the breath moving to? And that's always evolving. There's always more to learn with that, but that's essentially what we're looking at from that perspective. The neurological model, so we're looking at the nervous system function, brain, spinal cord, peripheral nerves, the autonomic nervous system's role in regulation and pain. I tend to do a lot within the neurological model of health. I do a lot of neural manipulation. I'll do some osteopathy in the cranial field. I really love working with the peripheral nerves and osteopathy, and a lot of its underlying modalities work really nicely to regulate the nervous system. I specialize in post-concussion recovery, and I find that this is a huge piece to when I'm working with a post-concussed individual is regulating that nervous system. Now, I would say I would add the visceral component of osteopathy, which came into play probably 30, 40 years ago, because that is innervated by the vagus nerve. All of our organs are innervated by the vagus nerve. And then that's also a huge part in the regulation of the nervous system. So I include visceral manipulation within the neurological model as well as the metabolic and energy model, which is where we're going next with the models of health. So cellular function, nutrition, hormones, and the body's energy production and regulation systems. Now, if we were a physician, of course, we would have the opportunity to introduce whatever medications whatever medical aspect of that, or if you're a naturopath, this is where it blends with the interdisciplinary model, because in a scope of practice, the Canadian osteopathic therapist cannot make specific recommendations for nutritional supplements or hormones or that kind of thing. We can work with the body's systems in order to ideally enhance functionality of that particular area, but this is where we would then refer out to someone whose scope of practice is very specific with that, if we feel like that would be a good fit. And then we have the behavioral psychological model. So, psychology, emotions, your social, your environmental factors. We've got stress, lifestyle, beliefs. We've got cultural differences. All of these things will impact health, your mindset. Again, we're not necessarily stepping into the role of a counselor in this scenario, but we might talk about the effect of stress on the body and how stress and emotions could be impacting your recovery from your injury or whatever it is that you're seeing the osteopathic therapist for. So there might be some conversation about lifestyle. I'm also a health coach, and I often coach around the deep health model and 6 aspects of deep health. That's where this tends to blend really nicely within the osteopathic model. So that's your basic classic osteopathic 5 models of health, and what we're looking for creating change in. So that's all fine and good, but then how do the models work together? So we've got these 5 different components, and then you're working on the individual. How does it work together? So let's take this example of chronic neck pain. So an osteopathic therapist is going to consider all 5 models simultaneously. Now, it might not be an even balance. I'm not looking at, oh, I'm going to spend 10 minutes in each model, but I'm thinking about all of these different systems as I'm doing my evaluation and my treatment. So from a biomechanical perspective, we're looking at cervical joint restrictions, muscle tension, for example, forward head posture. From desk work, does the person, I've worked a lot with welders who are welding above their head, and there's a lot of restriction in through the neck, the shoulders, and then all the nerve pathways in through there. And that takes us into the respiratory circulatory model. From the circulatory perspective, we're having reduced blood flow to the neck muscles. There's lymphatic congestion contributing to inflammation. If there's a biomechanical position, say, in how somebody's working or how they're spending most of their day, what's happening to the nerves? What's the nerve innervation into the muscles around that area? That's what I'm looking for. Are they breath holders? That can contribute to neck pain as well. So this is where we are looking at more of a global perspective. From a neurological perspective, again, it layers into that. So now are the nerves irritated that are coming out of the cervical spine? Is there altered proprioception? This is where you might go into vestibular therapy. Is the sympathetic nervous system being activated? So if the neck is out of balance, if the muscles are pulling, or if there's compression onto the nerves, is that affecting your vagus nerve, which then can affect things like anxiety, digestion, that sort of thing. Then we take it another level, metabolic and energy system. So now if we're getting poor sleep that's affecting tissue repair, then do we also have dietary inflammation? Is the person dehydrated? It's really difficult. If somebody has neck pain when they're trying to sleep, but we need sleep in order to recover, we've got to figure out the balance of how do we reduce the neck pain so that they can get better sleep, so that they can recover faster, reduce that inflammation. If there's, for some people, working with an anti-inflammatory diet can be really helpful if they have lots of chronic inflammation, arthritis, that kind of thing, that might be something that then you would talk with a naturopath and try to figure out, is there a dietary change that you could make that's really specific? And then we go into behavioral and psychosocial. Is the person under a lot of work stress? Do they have anxiety? What is the workplace setup? Have they changed jobs and now their desktop is is sitting a little different? Are they driving a lot for work? Are they traveling a lot? And what are their stress holding patterns? So as you can see, you may end up spending more time from a manual perspective in one area, maybe more biomechanical, but you're taking everything into consideration when you're trying to figure out what is the root cause of this particular individual's problem and the root cause of their neck pain. So having said that, it's a very comprehensive treatment because we're addressing the multiple models. The osteopath is treating root causes rather than just the symptoms. And that might include, like I said, the manual therapy, breathing exercises. I'm a huge fan of that. Stress management advice and lifestyle recommendations, and perhaps referral to other therapists. So, how does it work when you're going to see an osteopathic therapist? What is the assessment process looking like? So, we like to take a comprehensive history. Now, everyone's a little bit different, right? I've been to therapists who take very little intake. They really just want to dive into what they're feeling from the body. And I've been to therapists where the first hour is all intake and history. That might differ from person to person. I do like to have a strong understanding of their symptoms, their lifestyle, their medical background, who else they've seen, what's worked, what hasn't worked, and what brought them to me in the first place. So there could be a postural assessment that's going to be different for everybody. I used to use like a posture grid and a posture app and all that kind of stuff. I don't do that anymore. I'm really just palpating. I'm looking at symmetry. I'm looking at how do I create change. And the posture, it's, can poor posture cause pain? Sure, but not all pain is caused by poor posture. That's why it needs to be a very individualized approach. How do they spend their day is really what I'm looking at. Range of motion testing. Again, this could be more orthopedic. Personally, I don't do a lot of orthopedic range of motion, but I am looking for fascial tension lines. How does everything move? Where am I feeling tension in the body, and how is it related, or is it related to another area? A musculoskeletal assessment. I tend to do a lot of neurokinetic assessment, palpation. The osteopathic therapist, their primary thing is their palpation. We're touching a lot. We're feeling, we're manual manipulation. So the differential diagnosis, we're identifying root causes, not just the symptoms, as best we can. That's our intention anyway. Treatment planning is an individualized approach based on findings. So a lot of times I'll have people ask, how many treatments do I need? It varies. I've been working on people long enough that I have a general sense of what they might need moving forward after I've done their assessment and that kind of thing. But it shifts and changes, and everybody is so different. I often will suggest anywhere from 3 to 6 sessions. Maybe they might need more, maybe they might need less. I have some people who see me as their primary provider for their chronic condition. I might see them every 2 weeks or every month. I've got some people, I might see them once or twice a year. They just need a little assessment, a little tune-up, and then they're gone. And so the treatment planning is individual. It's not a very specific, oh, you need this amount of sessions in this amount of time frame for the most part. And again, this can change based on this scenario. So the key osteopathic principle really here is that we're looking for patterns of dysfunction throughout the body. with recognizing that the pain location isn't necessarily where the source of the problem is. And here we get to the different approaches in osteopathy. We've got the cranial approach. Oh, let me move this. So your cranial osteopathy, the focus is on the craniosacral system, the skull, spine, sacrum, and the subtle rhythms of the cerebral spinal fluid. Um, it may be very specific, like an Upledger or Sutherland cranial sacral treatment. It could just be osteopathy in the cranial field, which is more likely where I'm hanging out. I do a lot of neural manipulation, a lot of neural assessment. So that's really assessing the cranial nerves, but also the peripheral nerves, and then how it transmits throughout the body. So it's not just cranial, but I'm using the cranial system to give me some information and some feedback about where else in the body there might be a restriction. Cranial approach tends to be indirect, very gentle work. This might be where I don't know what they did. They barely touched me, but it felt great. That's kind of where that hangs out. Really great for headaches. Works nicely for TMJ. This is the type of system you'll see often with infants. Stress-related issues, chronic conditions tend to respond really nicely with more of a cranial approach, but again, individualized. Then there's the structural approach. So the focus is on the musculoskeletal system, bones, joints, muscles, the fascia, and the techniques are a bit more direct, higher force. We're not talking chiropractic adjustments, but not just assessing cranial rhythm, but more manipulation. So we might be doing joint mobilization, osteoarticular balancing, muscle energy techniques, myofascial techniques. There can be some light massage, friction, trigger point work. And again, this is best for joint restrictions, acute injuries, sport related. I tend to balance between the two because honestly, it depends on the person, it depends on their assessment, it depends on what they've done in the past, what's worked for them. I listen a lot to the individual. What has worked for you? How does your body respond to treatment? What do you like? That can also inform where I might go. And I might be more structural in one session with somebody, but then maybe I see them again, they've had a really stressful week and we redirect, we tend to do a more cranial session. It really can vary. There's also principles-based approach to osteopathy. The philosophy behind this is that the treatment's guided by osteopathic principles rather than specific protocols. This is where we might have a general listening. If you've worked with me before, you know that I often do like a general listening, standing, seated, on the table, various areas of the body. We're following what the body tells the practitioner. So you can probably guess this probably ends up more in the cranial side of things. But what I'm looking for is I'm looking for differences in tissue tension. I might be looking for heat differences. If there's inflammation, sometimes the skin will emanate heat in different areas. So I'm paying attention to those things, the differences between right and left, front of the body, back of the body, standing versus seated. That helps me localize maybe where the restriction is coming from. There isn't really a predetermined sequence from this perspective because we're treating the person specifically, not the condition. It's often more indirect, and I will let people know that it feels like I might be bouncing around a lot, but I'm not ignoring their primary reason. So if they're coming in, they're like, I have shoulder pain, I want you to treat my shoulder pain. I still want to do a global assessment because sometimes the shoulder pain from an osteopathic perspective can be from the liver. Is that a part of what's happening for them in this particular situation? So that's where you're a bit more principles based. Techniques based feels for some like a little bit more like a physio. It's not, but it's based on evidence-based protocols, which is your joint mobilizations and your muscle energy techniques. It's applied to specific techniques based on the diagnosis. The treatment plans are more standardized. It can be more and more measurable outcomes, and often more direct. This might be where it's not like chiropractic, but sometimes the physical positions are very similar. So chiropractic does the HVLA, the high velocity, low amplitude sort of thrust adjustments. In Canada, osteopathic therapists do not do the thrust. We don't do HVLA, but the body positioning might be very similar. Um, and I might use a more techniques-based approach if I've been working for somebody for quite a while. I already have a history. I already know what works for them. And they call me up and they say, I like tweaked my back or I twisted my ankle or whatever it is. I might then do more techniques-based approach on that person because I already have a history with them. I wouldn't necessarily use a technique-based approach on a brand new person that's coming into my care. So really in practice, most osteopathic therapists will blend both approaches, not always, using the principles to guide general strategy and then using specific techniques where it's applicable. And so I'm often asked, like, what techniques do you use? So we use a variety of techniques. There's soft tissue techniques, so your massage, stretching, myofascial. This is, you could use friction, trigger point, skin rolling. Sometimes I don't do a lot of skin rolling, but some practitioners will do a lot of skin rolling. There's cranial osteopathy. This is also the craniosacral. And the subtle techniques focusing on the head, spine, and sacrum. The strain counter strain, it's also called functional technique, position techniques to reduce tender points and muscle spasms. This can work quite nicely. I also work on dogs. I do a lot of functional technique on dogs. They respond really nicely to functional techniques. We do articulation. So it's gentle joint mobilization towards range of motion. Because I tend to end up more in the classic structural osteopathy, which is a lot of OAB, osteoarticular balancing, I use a lot of long lever, which means I might use the hip to create an oscillation effect. So I personally use a lot of oscillation type joint mobilizations. I just find it's really calming on the individual. It helps with blood flow, lymphatic flow, and joint restrictions. I just really enjoy it. Visceral manipulation, so gentle manipulation of the internal organs and the fascia that it's connected to improve function. Neural manipulation, so gentle manipulation of the cranial and peripheral nerves. So the nerves are all attached. So I'll work on feet, knees, hips, wrists, elbows, shoulders, head and neck. And then what does osteopathy help with? Mostly everything, honestly, just about every other modality that you might be using. So from a musculoskeletal perspective, back, neck pain, sciatic, nerve pain, joint pain, sports injuries, arthritis, postural issues, other conditions, headaches and migraines, it works quite nicely for post-concussion, excuse me, which is my personal love. I do a lot of TMJ work, excuse me. Pregnancy related discomfort. I don't do a lot of work with pregnancy. Personally, there are people who specialize in infancy and pregnancy, and they tend to do a lot more cranial sacral type of work. Digestive issues, it can be quite nice for chronic pain, and post-surgery is also quite nice. So when we're looking at working in a multidisciplinary clinic, it's but how I work personally is I'm quite collaborative in nature. I really love a collaborative approach with somebody. Everything works for people, but not always at the right time. So sometimes you need to see different people at different times in your recovery to get the best effect of what it is that you're looking to do. So when you have multiple perspectives on one person, you're treating the person, right? You have different perspectives on the complexity of that, what that individual is going through. And then from that perspective, you can have a really nice coordinated treatment. You can synchronize your care plans. You can see, oh, this person worked on this. Okay, great. They've got that handled. Let me step into this thing over here. Let me see where I can find some progress to move the patient forward in their recovery. Better outcomes. I think the patient is looked after. They feel really cared for, because they know that there's multiple people who are genuinely caring about their condition and want them to feel better. And I think they do get a better health outcome from that perspective because it's more patient centered, and the patient is can trust that everybody is working together for the benefit of the patient, and that's just a really nice place to be. So osteopathy and multidisciplinary care, we complement rather than replace other healthcare services. I do have some people where I am their primary person. They find that the approaches that I use with them works really nicely for them. And they'll see other people if they need to, but I'm the primary person. And like I mentioned before, there's times where their primary practitioner is somebody else, but they might come see me for little tune-ups or a little advanced assessment, depending on what it is we need to look at. So we work alongside, physicians, physios, chiros, massage therapists, and other professionals. If somebody I've had referrals from physicians for individuals who have fibromyalgia and chronic pain syndromes because they know osteopathy is really gentle and it works really nicely for them. I'll have physicians refer for post-concussion that's not getting better. Um, and I'll have referrals from other therapists as well. If they've sort of gotten their patient to a certain level, and again, they need a different perspective on what can be helped. So maximizing treatment success, I look at the patient, um, the patient therapist relationship as a partnership. I appreciate when the person I'm working with is an active participant in the care. They follow home advice. So if you're a patient watching this webinar, following the home care advice, which I know can be tricky. I am the worst homework person ever. So no judgment from me if you don't do your homework. I totally get it. But you also want to be really open and honest with your therapist about that too. And also coming in with realistic expectations. We do appreciate that when you're in chronic pain and you've gone from therapist to therapist, just really just trying to figure out how to get out of pain. When you meet a new therapist, there tends to be an expectation of like, okay, I need you to fix this now from that urgency perspective. However, we do appreciate it when you have a little bit more realistic expectation with that. Every time you meet a new therapist, they have to go through all of the history again. They have to look at what other people have done, and they have to figure out how they can do the best job they can for you. And that takes a little bit of time. And just being patient with the healing process and adhering to lifestyle modifications if required. From the provider perspective, our 50% of this relationship is making sure we're doing a thorough assessment. We're providing individualized treatment, being really clear with our expectations, being collaborative. I'll often say to people, if we want to bypass like the third party, have to write the note and all that kind of stuff, I'm happy to write a summary of the assessment and my findings, and I just email it to my patient, and they can do whatever they want with that. They can share it with whoever they want to. Sometimes it can be, if you're not in the same clinic with their other providers, it can get challenging trying to coordinate conversations and stuff like that, which is really why it's great being in a multidisciplinary clinic where your other providers are in the same clinic. It makes it much easier to collaborate on your treatment plan. And also, maintaining like an evidence-informed practice and creating appropriate referrals when necessary. So just remembering that healing is a partnership. Your active involvement in your care significantly impacts your outcome. And then from a practitioner perspective, being open to what other people are doing for your patient and really creating a nice like care, like a wheel of care. I look at it like a wheel of care. That can be just really, really nice and supportive. So I want to thank you if you've stuck it out for the whole webinar. I really appreciate you taking the time to learn more about osteopathy and understanding how it might be valuable to you. Osteopathy is just one valuable tool in your healthcare toolkit. Working with qualified practitioners and maintaining open communication with all members of your team is always really advantageous for you to get the best out of whatever care that you've decided to utilize. And, we really look at like your health, your team, and your journey is guiding the process. It's I really love that aspect of patient care with the back and forth, and it's a genuine relationship of with the goal in mind is always how can we make you feeling better and functioning more efficiently. That's always my mandate for sure. And see. Okay, I'm gonna just stop this share, come back to here. And so we talked about treatment, amount of treatments needed. It varies. I don't really set up a very specific treatment plan. It depends on the scenario. It depends on my assessment and what the individual is doing with other people. And I don't think there's any other questions that have been forwarded to me. If you do have any questions, please feel free to reach out at Catalyst. You can book in a 15-minute consult, and it's a phone consult. It's free of charge. If you are curious about osteopathy and how it might be able to help you and the condition that you have, or or the problem that you'd like to solve, I'm happy to set up a phone call with you. If not, you can always just send me a message and let me know what questions you have, and I'd be happy to answer them. Take care.